Now our next speaker is Dr. Shazia Shafi, and anybody who has been regular with JKCPJ events knows that she is, a regular invitee to our lot of events, and she is a very, famous motivational speaker in Kashmir, and also a recipient of gold medal from the President of India. So now I'd like to invite Dr. Shazia to share her insights.
Good afternoon, all of you. Thank you so much, Rehana, for a wonderful introduction. I don't know how much of a motivational speaker I am, but thank you so much. Thank you to JKCPJ for inviting me today here. I am by profession an ophthalmic surgeon, but my heart is into mental health disorders, diseases, and I interact with a lot of patients. I talk to a lot of patients, and I'm personally interested in this topic. So thank you for the invite again. To begin with, I would like to thank Mr. Kinger. What a wonderful presentation, and what a great initiative your organization is doing. I was actually thinking if we could have something like this here, like talk to me, how simple is that, but how effective it is. Because talking to someone and having someone to talk to at times is the only thing people need to come out of their shells. So I have been asked to speak about education, instrument of social change and enhancing mental health. Well, I strongly believe that education, without a doubt, is the most powerful weapon with which you can change the world. And these are not mere words. You can actually change the world with the help of education. It is the movement from darkness to light. It is indeed our only hope to bring the positive changes that we want in our lives and in the lives of ones we love. Anyone can become literate, but not everyone can be educated. Well, I want to emphasize on that everyone here is literate. Literacy is prevalent quite a bit, but not everyone is educated. Well, how is that? Literacy is when you read news and articles about mental health. Well, you read them. But education is when you understand about mental health and do not stigmatize it. Literacy makes you competent, but education makes you compassionate. High levels of education have been associated with better mental health. Causal relationships are notoriously difficult to establish and are generally multifactorial. Nevertheless, education has been shown to be one of the clearest indicator of life outcomes, such as employment, income, and social status. It is thus a strong predictor for improved health, both physical and mental health. Education can help us in two ways to fight mental disorders. Firstly, an educated person can identify his or her own mental health issues, his or her mental health symptoms, and is more likely to come forth for help. Secondly, an educated person can better understand a fellow human being's mental health and will be more considerate and compassionate, and more importantly, will not stigmatize it. To understand the stigma associated with mental health disorders better, it is important to understand what a stigma is. Stigma is when someone negatively views another person based on their uncommon and distinguishing characteristics or personality traits that are not considered to be normal in the society. Such notions lead to discrimination, and discrimination in turn leads to stigma. It's a vicious circle. It has been observed that the stereotypical ideas stem from ignorance and lack of awareness about mental health disorders, which are held by people irrespective of age, education, gender, status. So, why is it necessary to be more aware? A person suffering from mental health disorder, when they are subjected to prejudice and discriminatory behavior, will only sink deeper into agony. Stigma can have very harmful effects on someone seeking help, as it is bound to hinder recovery. It is due to this stigma that even health insurance companies don't adequately cover treatment expenditures for mental health disorders. How sad is that? It is very sad that stigma also leads to lack of understanding by family, friends, co-workers. There are lesser job opportunities and even trouble finding housing. So what can we do to cope with this stigma? Around 450 million people worldwide, 450 million is a huge number, have mental health related issues. So all people suffering from mental health disorders must know that they are not alone. Just because someone is not coming openly about it does not mean that they don't have it. The first thing is to understand that you are not alone. I'm not alone. Even when nobody around speaks about mental health disorders, we must not assume that it is non-existent. It is also important to know that being silent won't help you. So what do? We seek help. We seek help and know that it is available and treatable. See, we have these wonderful NGOs, organizations, psychologists, doctors, volunteers. Just now we learned about Talk to Me. So there are people who are there to help you, but we only get help when you ask for it. So you should always ask first. Do not let stigma create self-doubt and shame. So accept your condition first, and from that acceptance, you will seek a solution. Do not isolate yourself to a point where you do not find help or support. You don't have to go and talk about your condition to everyone, but at least do not hide it from important people in your life. Like, it could be your spouse, it could be a family member, it could be a friend, and most importantly, it could be a healthcare provider, your doctor, your therapist. You need professional help. Don't equate yourself with condition. This is something I personally believe in. You are separate from your disorder. So instead of saying, I am a drug addict, say I have drug addiction. Instead of labeling, he's a schizophrenic or she's a schizophrenic, no, you say she has schizophrenia or he has schizophrenia. Your disorder is separate part of which can be treated and which can be improved. And other thing which can be done is join a support group. There are, in addition to various kinds of psychological and psychiatric interventions, self-help and support groups are also an integral part of recovery process. Healing power of support groups can be extremely therapeutic when people facing similar issues and behaviors. Now, here is where education plays an important part. It helps in destigmatization of mental health disorders. Educated and well-aware people are more likely to talk openly about mental health without making it a taboo. An educated individual will be conscious of the language that he or she uses with respect to a mentally ill person. We have to understand that, as Mr. Kinger already said, that we have to understand that just like any other physical ailment, suppose I'm a doctor, I get patients with various eye disorders, I get hypertensive patients, patients have diabetes, patients have thyroid disorders, there are patients who have cancers. We are empathetic towards them, we know they have a disorder, we give them treatment. Similarly, mental health disorder is also a disease. It is a disease that needs proper treatment, that needs care by a professional. It needs to be addressed by an expert, and it also needs treatment. Just because it's not visible from outside doesn't mean that it doesn't exist. We have to encourage equality between physical and mental illnesses and show compassion for those with it. We have to be honest about treatment, and most importantly, we have to choose empowerment over shame. Education about mental disorders needs to be incorporated in our schools. It's high time now. We need to teach them young. Students learn about physical health, about nutritional health. Why not about mental health? When children of today are the worst sufferers in the last 2 years, they have been going through a lot silently. Why don't we teach them about it when they are young? It will help us in two ways. One, it will inculcate young minds with awareness about these disorders so that they are compassionate and understanding and do not stigmatize it. Secondly, if any child is experiencing distressing symptoms, he or she is more likely to come forth and talk about it and seek help in time. Mental disorders can affect classroom learning, such as poor attendance, difficulties with academics, performance, poor social integration, trouble adjusting to school, problems with behavior regulation, and attention and concentration issues. all of which are critical to success of a student. Even in high school and college students who screen positive for psychological dysfunction, there is an increased report that there may be chances of dropout, or they may have more missed days in the college, or their overall academic achievement can be compromised. So these children, what do they experience? They experience, as has been already discussed very quite nicely, anxiety, attention deficit hyperactivity disorder, paranoia, depression. These are the students which are more likely to fall into traps of alcoholism, drug addiction, or even have suicidal tendency at times. So this needs to be addressed well in advance. And I just want to say that education can and education will make our collective voice sound like bravery, strength, and persistence, the qualities we need to face mental illness and to fight stigma. No matter how you contribute to mental health, you can make a difference by knowing that mental health illness is not a stigma. It is not anyone's fault. No matter what the society says, you and me, we can make a difference. We just need to come forth and talk about it more openly. I would just like to close my talk with a quote by Glenn Close, which says, what mental health needs is more sunlight, more candor, and more unashamed conversations. Thank you so much for a patient hearing.
Thank you so much, Dr. Shazia, for this wonderful presentation.